I had to. Let's continue. Everybody understands that. That's great. Yeah, I would like for them to still let us Zoom on Fridays, but I don't know. I doubt that because we're gonna have to do like tests in person, so we'll need Fridays to take tests. All right, so we talked about dystocia and we kind of moved on from it already. So we know it's difficulty giving birth. So it can be pretty interesting with how severe it can get. I think I've already showed you guys this picture, a very large baby and a small dog. It does occur. Um, so we do need to be aware of that. Remember, the smaller the dog and the smaller the female and the bigger the male, it's most like it can be pretty scary because they can have a really large baby. So the more puppies, the less large they are. So that's pretty important. So inappropriate behavior, this does happen. It definitely, just like looking into it, it's caused by hormonal issues, and it literally just makes them kind of do the opposite of what they should do. And it does happen. I don't believe that it's behind if you touch the puppies too soon. I feel that that's kind of a myth. A lot of people seem to used to think that that was a thing, um, but it's not. That's not really the case because I've seen some rescue dogs who have puppies. Their puppies have been touched and they're okay with it. Dogs who have C sections, their puppies have clearly been touched and they seem to be fine with it. Does that make sense? So I don't think it has anything to do with that because literally in a C-section, you're removing the puppies. You're touching them before the mother even sees them. So you kind of have to think of it that way. So definitely, they should allow nursing, grooming. They have to groom those puppies. So they have to stimulate the cardiovascular system. They have to stimulate the respiratory system. Stimulate elimination or removal of waste material. Has anybody in here ever taken care of like newborn puppies or kittens? Because if you like the little babies, because it is dedication. So we actually, after Hurricane Ike, my sister-in-law and my brother, their cat had kittens during the hurricane. Like they could not move her when we had to evacuate. And so when we were able to get back onto the island, we had to get the kittens, but the mama wouldn't come out. So we had like less than 2 week old kittens that we had to around the clock stimulate and feed. And it was a pretty interesting situation, especially since we were all homeless and we were living with our parents because we were all misplaced. So we're taking care of like these 6 little kittens. Plus, we have like we're just staying in her parents' living room. So that was a lot of work, and we would all switch off. There was 3 of us: my brother, his wife, and myself. And it was funny because throughout the night they would start crying and they would need to be, fed or stimulated, and we'd be like, "It's your turn." Like we would be hitting each other. So I felt like the 3 of us like raised 6 little babies together. Um, but yeah, so it definitely the mother should be doing these things exactly what you would be doing while exactly like what we would be doing if we were taking care of a bottle baby. They need to retrieve them. They need to protect them in a way that it's not super aggressive, but that can happen too sometimes. Sometimes the dogs will be a little more aggressive, so you have to be careful with that. They should not attack, kill. I know, cannibalize. That is a thing that does happen. Be overly protective, restless, or aggressive towards them. So you just kind of have to watch and see if that is something that you are witnessing. If that's the case, we need to remove those babies from the mother and take on the responsibility. Well, okay, so the boy cats do that. I don't know why. So like sometimes like stray kittens, like if they don't just die off, I think it's because the boy cats ate them. It's really gross. Um, huh? I don't know if that's always the case, but I have definitely heard stories of how the boy cats usually shouldn't be involved with the whole baby situation. Just the moms, maybe. They need to be single moms. Um, but yeah, so I have definitely, and I always wondered like when I would see stray cats, like when the kittens would start to trickle off, I'm like either they were sick, could be their blood type, could be that they just got sick, or I don't want to think about the alternative here. So probably was me who told you that. What an awful thing for me to tell you. Okay. Okay, so we have lactation disorders, agalactia, so lack of milk production. Usually there's different causes behind this, like stress, it could be nutrition, premature birth, right, or infection. Definitely, I know just from human side, again, I have not had a kid, but I know that that is something, one of my friends is a neonatal nurse, and she did say that that is something the mothers sometimes have issues producing the milk, right? Which can be bad because it can lead to other more concerning situations. So then we have galactostasis, so milk stasis, which means milk has stopped coming out, right? So it can result in mastitis. So basically, it's not coming out like it should, and when it doesn't come out, then it builds up in there, and then it's going to get inflamed, and it's going to be very painful, and it's going to be awful. You actually see this a lot, mastitis in goats. I don't know. You just see it in goats. I'm not sure if it's based off like how large the teeth get with goats, but we've definitely seen it like on the farm. We saw it a lot with goats, and they teach you in large animals that you see it. I know, it's really weird. I don't know why. Maybe because they're one of those animals that you can just milk, like in general. I don't know. It's fine.
We had a cow in Kentucky that she produced so much that one of her cat, like she only had one calf, it wouldn't like help her, so she would get clogged ducts all the time. So we ended up getting like another calf who lost its mom and just had both of them suckle and it helped. But she would get clogged ducts all the time. I don't know why she produced like way more. Just it was weird.
Hormonal issues. It's definitely a hormonal thing. So you probably see it in cows. Were you asking about that with the cows? Yeah, so you're going to see it more on the large animal side. I just know personally when we were on the farm, we saw like 3 of them, 3 goats. And actually all the cows, we didn't work with milk cows, so that's probably why I didn't see any milk cows. Just all the boys. But yeah, so you're going to see it with them. I guess it is a hormonal thing. So I'm not sure. Like, I'm not a large animal person. I literally walked away from the farm with the skill of being able to sit up a sheep. That's how I feel. Okay. So we know this can result in mastitis, so septic inflammation of the mammary gland. This is very painful, discolored milk. They usually will have a fever because they do have an infection. Reluctance to allow nursing, which makes sense. If it's painful, why would you let them nurse off of you? And then sometimes it can be bad enough, like where they actually have an abscess. So not good. Ooh, and we have a video. Let's see what I'm about to show you. I know, I'm like, what is it? We shall see. It's warm in here today. I need a fan.
All right, Don.
He's a little strange, but he gets the job done. I don't know. He's a little weird.
Here at the Paws Veterinary Clinic. We're here with Pepper. Pepper is a rescue dog this family just recently rescued from a bad situation. We saw her the other day, we vaccinated her and so forth. We did notice at the time that she had quite a bit of mammary development. And actually, she was most likely in a false pregnancy, producing a little bit of milk here at her nipples. She came in today because right here, she actually has where a mammary gland ruptured. She had developed mastitis. Mastitis is an infection in one of the mammary glands. Dogs who are lactating or in a false pregnancy are prone to infected mammary glands that abscessed and it actually ruptured. Now at this point, because of the infection in here, we'll go ahead. We don't really recommend or advise closing that up because you're basically just predisposing it to abscessing again. So we will put her on a good antibiotic for a couple of weeks. We'll put her on something, an anti-inflammatory for pain and inflammation. Try and get her something so that she doesn't continually lick at that. And this will heal up beautifully. Also, we talked to them. We do want to get her spayed. After this heals up, after her abscess heals, after her mammary development shrinks back down, we will get her. She's a good girl here. You know, she's just laying here, and we will get her spayed and prevent this mastitis, false pregnancy, and so forth, those situations from occurring again. All right, bye now.
Okay. All right. He's a little weird, but you got to see what it looks like when it ruptures. So that was really cool, not for the patient, but for
Thank you, everybody, for coming this afternoon.
Yeah, so it can definitely be pretty pretty brutal and like gross, but I've never seen one that bad where it's actually fully ruptured. But I have seen it where it looks like it's about to rupture, and I'm like, ooh, it's not good. Like, this is bad. That's what it looked like on the goat that I saw. Looks a little rough. I don't want anything to do with that. Okay. So what do we do? Well, antibiotics, right? Because it's full of pus, right? If they have mastitis. Warm compresses actually help kind of decrease the swelling. And then don't allow nursing, which makes complete sense. Don't do that. That's not going to be safe. So, but yeah, basically that's what we're going to do. We're just going to go ahead and we're going to give antibiotics. We're going to kind of use warm compresses and try to help the swelling go down. If it ruptures, then you definitely have to do a little bit more. We're going to have to flush out the area and get pretty brutal. I feel like with the goat, we, well, no, it hadn't really fully ruptured. I don't know, but I know that you have to flush out the area. You don't want to close it up if it has ruptured or anything like that, because it would make it worse. Huh? Oh, the friendship thing? Yeah. I actually, one of my favorite instructors, she had this quote on her PowerPoints. And so I really liked it. Okay. So vaginitis is our next one. So inflammation and inflammatory process, right? Not necessarily an infection. So inflammation of the vagina, basically what it says. So there's actually two types. There's the puppy one and then there's the adult. And we are going to talk about, we're actually going to talk about the puppy one first. So we can kind of focus on that and then we'll go into the actual adult one. So common signs of our puppy one, vulvar discharge. They usually do respond pretty well to antibiotics when they have the puppy vaginitis. And it usually does go away after their first heat cycle. But we're going to kind of talk about how sometimes when they end up having adult vaginitis, it's like it just continues. They'll just continuously get it throughout the years. So puppy vaginitis, usually hormonal fluctuation, right? We will see purulent vulvar discharge. Sometimes they'll be licking at the area because it's irritated. Definitely systemic antibiotics. Usually the condition resolves naturally after their first heat cycle. So that's good to know. It's like once they have a heat cycle, usually it goes away. But we're going to talk about how sometimes it doesn't, and you should just get them spayed. Adult vaginitis, right? Usually the cause behind the adult one, because they have it as an adult, is anatomical abnormalities. So we are actually going to talk about that, how sometimes where it's like inverted. It's not common that you'll see situations like that, but it can happen. Canine herpes virus, I thought this was interesting. It's also known as fading puppy syndrome. It's a viral infection. It infects the reproductive organs of all of adult dogs, not all, of adult dogs. While the adult dogs infected with it usually don't show symptoms, the infection is the leading cause of death in newborn puppies. Did you guys ever go over like fading kitten syndrome with the blood with cats? That's fine. You'll go over it later. It's pretty interesting. We're not going to go off down that trail though.
We talked about it briefly when we went over blood.
Okay.
The different blood types.
Yeah.
Yeah, so this is different though because this is actually like a virus. But it's similar, right? It causes them to basically die. Let's see. So the canine herpes virus is passed. It lives in the reproductive tract of adults, male and female, passed through direct contact. Puppies get it from nasal discharge from the mama, so that's kind of interesting. As an adult, they could have stillbirth, miscarriage, genital sores. Pretty intense. Clinical signs of vaginitis, purulent discharge, licking at the vulva plus or minus, perivulvar skin irritation or infection, and then perceived urinary incontinence too. It can be to the point, depending what's causing it, that they have urinary incontinence. Sometimes it also is uncomfortable for them to urinate in general. Here's an inverted vulva. So it's like inwards, so that's going to be irritating for them. This is much worse. Hyperplasia or prolapse. This occurs under the influence of estrogen. So basically, we're going to see swollen vaginal tissue that protrudes from the vulva. I'm not kidding, it protrudes out. We actually had a dog that came in. I don't know if y'all were on campus. Were y'all here with that dog that had the vaginal prolapse? If you were, you would remember. It was really awful. It was huge, and I was like, I felt so. We fixed it. We everything's fine, but it was like, ooh, a lot. It was intense. So basically, with this prolapse could be caused by vaginal hyperplasia, right? So actually, the a proliferation of vaginal mucosa, so it grows larger, and this is due to the animal not being spayed because of the estrogen levels. So treatment is ovarian hysterectomy, right? It resolves the condition permanently. So you should probably do it. Sounds like a good idea, right? Sometimes it will resolve spontaneously, but it usually will reoccur when they have an estrous cycle. So if you get them spayed, then they won't go through the estrous cycle anymore, and then the estrogen levels won't get super high, and then we won't have this. Does that make sense? So basically, everything that I've taught you so far in the reproductive system is to spay and neuter. Okay, great. Well, spay so far. We're going to talk about why you should neuter. We're going to get there. Yes, this is what I was. Yes. Could be genetic, could be high levels of estrogen. Eef. Not good. Looks awful. Okay. So this is next up, the pyometra. Everybody has heard of a pyometra, right? You probably talked about it in intro. So pus in the uterus, that's literally what it is. So high levels of the progesterone causes several changes in the uterus. So we know that progesterone helps maintain the uterine lining throughout pregnancy. But in this case, the uterus will fill with pus after ovulation. So the pyometra is actually secondary that occurs as a result of hormonal changes in that reproductive tract. Basically, following the estrous heat cycle, the hormone progesterone remains elevated for up to 2 months and causes lining of the uterus to thicken in preparation for pregnancy. So the increasing levels after ovulation will cause enlargement of the tissue, right? And hypertrophy of the endometrial gland in the uterus. So basically, it's going to be a secondary thing, and it's going to fill with pus. It's not good. It's very gross. So hyperplasia, hypertrophy of the endometrial gland, decreased uterine contractions, right? There are 2 types. Your book does not mention the 2 types. It just mentions pyometra, but I'm going to tell you the real truth in real life. There's an open and a closed. So basically, when it's open, the cervix is open and you'll see discharge. When it's closed, the cervix is closed and it's just building up. So if they're gonna have either one, you would want them to have an open one, but it's still awful, right? Yeah, okay. It's a little scarier when it's closed because nothing is coming out. So it's just building up. At least when it's open, they're having some sort of discharge. So some of it is leaving the body, but it's still not a good situation. Okay. So we know that this will predispose uterus to bacterial infections. The most common bacteria isolated from a pyometra would be E. coli. E. coli is a nasty, nasty bacteria, man. There's a couple that I'm like, when I hear them, I'm like, ooh. Like, wasn't there E. coli on lettuce once? I don't know. That was romaine. Oh, it was romaine. Okay. I was like, see, I'm telling you, like, they could have E. coli in their uterus, or you could have E. coli on lettuce. Like, come on, man. Like, it'll just go anywhere. All right. So we sometimes will see vulvar discharge if it's an open. Abdominal enlargement, depending how large it gets. Vomiting, dehydration. We can see polyuria, polydipsia, because it can look similar to kidney issues, especially just in that area, based off like hydration levels with the pyometra. Azotemic, right? Because we definitely have a buildup of toxins because of pus in the uterus, which will definitely start to show clinical signs of a urinary. We can diagnose this by a radiograph. You should not see a uterus on a radiograph. You shouldn't. It's so tiny, we should not see it. The only time we see it is when there's puppies in there and when they have a pyometra. So you shouldn't see it because it's itty bitty. Ultrasound, that can let us know as well. And then blood work would also be helpful. Leukocytosis, neutrophilia with a left shift. That's just neutrophilia, increased amount of neutrophils, right? Left shift is an increase in immature neutrophils. So the body is trying to fight off infection, so they're sending out neutrophils before they're ready. Which you guys probably have gone over that a little bit in ClinPath, that class. If you do see discharge, it's very interesting. You'll see white or green colored discharge coming from the vagina, which sometimes can be a little confusing because, like for instance, my friend who had that Frenchie, when she didn't know that she got pregnant, we were nervous that it was a pyometra because she was seeing discharge. And we were like, well, she's not pregnant. There's no way. But there was a possibility because it happened, right? Which was a little bit safer than a pyometra. Okay. So this is what it's going to look like. That's a big difference. That's not good. All right. So this is just kind of showing you, turn the light off. This is kind of showing you how we can see small intestine, colon, stomach, spine, liver, but you can't see the uterus in there. You're not supposed to. We shouldn't. That's not a thing. That's a uterus. That's bad. It's huge. That's no bueno. That's also what it looks like. So an open pyometra, when cervix is open, it allows drainage. So you'll see that. Preferred treatment is ovarian hysterectomy as well as antibiotic and fluid therapy. I did read up that you could possibly, if it's not a large pyometra, you could possibly just treat with antibiotics, but the truth is that's super risky. And if it happens once, do you think it'll probably happen again? Yeah. So maybe if it occurs, you should just take it out. So I have a really funny story about a pyometra. You're like, that's weird. It is weird. Okay. So there was this little Yorkie. Her name was Fancy. Fancy was about 3 pounds. Fancy was also a complete jerk. Nobody liked Fancy because Fancy was mean. So Fancy came in at 12 years old, I know, with a pyometra. and she graced us with her presence. So basically, Fancy became septic, though. So it wasn't just let's remove the pyometra, give her some antibiotics, and she'll leave in a couple days. Fancy stayed a week, because why not? Fancy tried to bite me 1,000,000 times. Fancy was also in a top kennel because we were very busy and we couldn't put her in a lower kennel. Wouldn't have mattered anyway. She probably would have ran. Fancy also, I found out, she would always pee in her kennel. She was awful. And I would take her outside, and when I would take her outside, she would literally try to lift all her legs at once. And I was like, but you have to touch the ground. And then her father, who was this very big, bulky man, came in to visit one day, and he said, oh, Fancy never goes outside. Like, she uses pee pads. And I was like, wow, okay. So I literally started putting pee pads on the floor, and I would take her out and let her pee on that pee pad. It was so weird. Anyway, so Fancy, like I mentioned, she had a pyometra. She was 3 pounds when she came in. Her pyometra was half of her body weight. She went down to 1.5. I was like, good gosh. It was really funny, though, because her father brought one of his T-shirts so she could have something of his. And then the second he left, she peed on it. But I remember Fancy, and I was like, oh, Lord, little Fancy. She did make me crazy for a whole week. She did try to bite me a lot. I usually had to grab a towel to get her out of the kennel because she was constantly trying to attack me. And then also she would always pee in her kennel, even after I would take her and put her on her pee pad, because why not? She was great. Okay. Anyway, Fancy survived, and she had to stay with stay for IV antibiotics because hers was bad enough that she became septic. Not all cases are like that. Sometimes you can just actually remove it, and then you can give them antibiotics. They'll stay maybe overnight, maybe a couple days, and then they can go home. So with a closed pyometra, the cervix is closed, as I mentioned. This could lead to ruptured uterus from it being closed. The dog may have no more than 24 to 48 hours to live if not treated, if it fills up. You can use antibiotics if not a severe case, but it's likely going to happen again. So I'm going to show you guys a video of them removing a pyometra. Yes, there are some patients. Some patients I remember because they were just so cute, and other patients I remember because they made me insane. Made me question why I was doing what I was doing. Fancy was one of those.
Did you know that the average?
All right. Here we go. I think it's really funny because on YouTube, they give you the option to, like, for the first couple seconds you can't, but then they give you the option to skip. And I'm like, everybody probably always skips. So why do we even have this happening? But that's okay. All right.
Welcome to Vet Ranch. I'm Dr. Matt. This little pup is named Maisie. She was just found by a family. She wandered up, and she seemed to be kind of lethargic, not really feeling very good, like a normal dog would. And she also had a discharge coming out of her vulva. They took her into an emergency vet, and the emergency vet ran some blood work, saw that she had a high white blood cell count, and then put on some antibiotics. We just got her in and took an x-ray. It looks like she has a pyometra, meaning her uterus is full of basically pus and fluid, and is an emergency procedure. You need to get it out of there because it's just a big, nasty infection. So we're going to go in there today and basically just spay her and try to get that uterus all out in one piece without it busting open and spilling into that pus in her abdomen. And that should make her be able to clear that infection out of her bloodstream and feel a whole lot better. But her gums are real pale. It kind of shows you how sick she is. She's anemic. And then with that high white blood cell count, she's just not feeling very good. So not ideal conditions to go into a major surgery like a spay, but we don't really have any other option. We need to do this right now. So we're going to get started. done with surgery. It took about a little over an hour, I believe. Look, there's sweat on my head. She did well. It was a pyometra. She had a big pus-filled uterus. There's her main incision. There was a little lump under one of her nipples over here, so I went ahead and took that out just in case it was a tumor. Here is her uterus, and you can see it's a lot bigger than it should have been. It's big, full of pus. This is her uterine body, so this goes out to the vagina. These are her 2 uterine horns with ovaries on the end. So pretty nasty, and if that thing would have busted inside her, which sometimes they can, that would have killed her pretty quickly. So right now we're just waiting on her to wake up. One day after surgery, and Maisie is doing well. Good girl. She's still sick. That bacteria gets in her bloodstream and will make her really feel bad, but you can see she's not too bad. She did eat her food today. She's not vomiting or anything, so all's good. Maisie's doing well. It has been 4 days since surgery. She is pain-free and happy, eating good, acting good. We are going to send her home with a foster now. They'll probably keep her for a couple weeks, and then they'll bring her back into us to get her stitches out. And we'll get you an update then. It has been about 3.5 weeks since we did her surgery, and this little pup is feeling a lot better. When she first came in, she was really depressed and lethargic. Today, we opened up her little kennel door, and she just started running around and very playful. Now she's smelling something. Good girl, good girl. But she is totally healed up, got that whole infection out of her system, and is a new dog. So we're going to send her home. She'll probably easily get a home because she's a very happy-go-lucky, easy to get along with dog. So thank you for helping us with Vet Ranch and supporting what we do so we can support Maisie. We will see you next time.
Okay. All right. Poor little lady. Okay. Okay. All right. So that's how you fix a pyometra, right? So they'll need antibiotics, fluid therapy, and then of course an ovarian hysterectomy is the best option. And like you said, you don't want it to rupture. It can be pretty bad. Definitely seen them a lot larger than that. It can be pretty bad. So I'm going to skip ahead really quick to something. Maybe, never mind, it's frozen. Here we go. Because we're about to talk about boy diseases. So I'm going to talk to you about an ovarian hysterectomy real quick. So we can just go ahead and see a spay. And then we will move on to boy diseases. Sound good? Okay. So an ovarian hysterectomy is just going to be surgical removal of the ovaries and the uterus. So you guys are going to get to watch one today as they go over how to spay a dog or a cat. It's the same concept. And you guys will get to participate in this when you go into surgery. In real life, you don't normally scrub in for a spay. Hold on, I'm having some issues with this right now. And then we will move on to prostate issues. Yeah, but you guys get to scrub in when you're here on campus because it they want you to actually like look in and see how it's done and so on and so forth. It's Vet Ranch again. How convenient. I didn't know that. He usually does pretty well with explaining. They had one on Dove, but I didn't do the best. They just kind of. There's also really cute puppies involved.
Welcome to Vet Ranch. This dog is Sunny, and these are all of her puppies. They are around 7 weeks old. We don't know a whole lot about her. except I know that she needs to be spayed before she can be adopted. So we're going to go ahead and take care of that today. We have her puppies. They're just kind of here for fun to be with their mama. But I'm going to go ahead and spay her today and kind of walk y'all through how a spay works, just so you know. And yeah, I'm going to go ahead and get started right now.
It's pulled up as you can see in the uterus where her puppies were. I'll show you. It takes a second to start. But enjoy the cuteness.
She's anesthetized, going to make my incision right on midline. This is her belly button right there. I'm going to go right under that.
Linnea alba. That's what you cut through. No, I have surgery.
She goes, "How do you have these puppies here?" And I was like, she goes, "Do you just always keep these puppies at the clinic?" And I was like, "No." And I was like, "Have you seen the YouTube stuff?" And she was like, "Yeah, I know you blow up stuff on YouTube, but you won't tell me what the channel is." And I was like, "Well, have you seen the vet channel?" Here's the skin incision. Here's her midline. This is called the linea alba. That's actually her abdominal muscles right there. I'm going to cut right along the linea alba and get into her abdominal cavity. We are now in the abdominal cavity. So now basically we look for her uterus, and I found it. This is her uterus. They have a uterine body down here, and this is her left and right uterine horn, and they go up to her ovaries. This is an ovary in my hand right there. That's her left ovary. Here's her right ovary right here. And so in a spay, it's called an ovarian hysterectomy. So we take the ovaries out as well as the uterus. I'm going to go ahead and start working on this left ovary and clamp it off first, and then we'll get it tied off. Here is the left ovary right here. I have a clamp underneath it. I'm just going to put some suture down here. There's a big artery, a couple big arteries that go to that ovary, and I'm going to tie that off, and then I'll cut the ovary free. All right, so I have that tied off right there. I don't know if you guys will be able to see that little bitty suture. I'm going to go ahead and clamp the body side of this and cut the ovary out. So now, in my hand, I have her little ovary right there. That is her left ovary. I'm going to go ahead and release this, and then I will go and get her right ovary. This is kind of neat. You can tell where those puppies were in her uterus. There's a little lump there. There's a lump there. There's one right there and one right there. So she had two puppies in each horn of the uterus. Kind of interesting. Here's her right ovary. I'm going to go ahead and tie it off now. I already have the clamp under it. Here is the right ovary. Have it tied off down here. Going to go ahead and cut it free now. And there it is, little ovary right there. So now I'll set the stump free back in her, and I'll go ahead and take out, now we go across and get this uterine body, pull that out. You'll notice there's some big vessels here. That's what we watch out for. That's what you don't want to hit without tying off. Have her uterus tied off down here. I'm going to go ahead and cut it free. Here is her 2 ovaries, her uterine horns, and where they connect down here at the uterine bifurcation. Drop this back in, and next step is suturing up her muscular body wall. All right, her muscular body wall right there. These are abdominal muscles are sutured closed. Now I'm going to suture some subcutaneous tissue up, and then it'll be the skin. Our subcutaneous tissue is sutured up. Now I'm going to do a skin suture, and I'm going to bury the suture line so that you won't be able to see the stitches, and it'll all just be absorbable suture, dissolvable, and they won't ever have to pull the stitches out. Put a little tissue glue right over this just to help seal it, and everything looks pretty nice. Going to go ahead and wake her up now. She's up and moving about. It's about 30 minutes after surgery. She seems to be doing pretty well. We're going to go ahead and go put her up for the night and let her sleep. Good girl. Good girl. Sometimes when you're feeling young and you're feeling tough and you're all caught up, but you don't walk right and you don't talk right and there ain't nothing. It's the day after surgery and we are feeding the little puppies. Mom is doing good. She's trying to eat as well, but our puppies are obviously getting good food. We're going to vaccinate the little puppies today, and they will all go to be adopted. So thanks for supporting Vet Ranch and letting us do this. Thanks for watching, and we will see you next time.
Okay. All right. So that's a spay. Pretty exciting.
Those were some big old puppies for her.
Yes, they were. Okay, I'm sorry, what? Usually if they weren't dissolvable, we would have them come in like 10 to 14 days to go ahead and have them removed. Oops, sorry, reshared that. So usually about 2 weeks. Maybe a little bit longer, but they'll dissolve, like it should be fine. Oh, like I guess it kind of happens at the same time. Like they just kind of just go with, because when you remove them, like it's already, like you don't need them anymore. So they'll probably just dissolve as it gets better. I need to find the PowerPoint. I lost it. Here it is. Okay. I was like, how do you lose a PowerPoint on your computer? All right. That's why I looked confused. All right. So let's go into prosthetic diseases. So we know that the prostate, right, sex gland in the dog and cat. Remember, the prostate is the only one that dogs have, right? That's their sex gland. That's the one that they have. Located just called to the bladder, it encircles the proximal urethra at the neck of the bladder. So remember, when you look at this picture, here it is. Purpose is to produce the fluid, right, as transport to support the medium for sperm during ejaculation. So prostate diseases are going to be more common in dogs, right? They're larger, their prostate's larger than in cats. Let's see. We already talked about that because we went into anatomy. So as you can see, here it is again. So prostate increases in size and weight as the dog matures. If they're neutered at a young age, the prostate growth is stopped. And we'll actually talk about when they're neutered, how it decreases in size. So that's helpful. So the first thing we're going to talk about is benign prostatic hyperplasia. So basically, the prostate is enlarged. So it's caused by an altered androgen-estrogen ratio. So basically, like, it's an altered male sex hormone, right? So for developing, responsible for development of secondary sex characteristics. So basically, they need testicles for this to occur. And so their hormone levels are altered, and therefore it causes their prostate to get enlarged. But if we remove the testicles, we don't have an issue with those hormones anymore. So therefore, it will not become enlarged. Does that make sense? It's like the concept behind it. So mild or no clinical signs, depending, they can have tenesmus. Tenesmus is just the feeling of where they feel like they have to pass stool, but they really don't. It's just because when the prostate gets enlarged, it actually pushes up on the colon and it makes them feel like they have to defecate. So that's uncomfortable. Enlarged prostate, but usually not painful. Castration will result in 70% decrease in the size within 14 days. So we need to neuter them. Yeah, that's important. Okay. That's the best option. So like I said, high levels of estrogen, androgen, which causes their hyperplasia. So you can see enlarged and it's pressing on the colon. Okay. Prostatitis. So bacterial prostatitis may be acute or chronic, and it affects sexually mature dogs, right? Again. Let's see. The prostate gland is predisposed to bacterial infection through the urinary system, as well as direct infection of the gland itself, right? So here's a kicker, and this is easy to remember. E. coli is the most frequently isolated bacteria involved with this. What else do we see E. coli with? Pyometra. I was like, we just went over it.
Pyometras.
You're talking about pyometras, E. coli, and how you can even find it on lettuce. So these guys' clinical signs, so they can be lethargic, anorexic, can have a fever because of the infection. We could do a urinalysis. We would find hematuria, increased white blood cells, presence of bacteria, because it's letting us know that they do have a bacterial infection. So not only will they have prostatitis, but they can also have a UTI, right? So what do? Treatment, antibiotics. Oh, and look, castration. Huh. Another treatment option. Here we go.
How often do you see this?
I've never seen none of this so far. I don't know if I've seen any prostate issues. Not really like it. I mean, it's a thing. But remember, like the previous one, the hyperplasia, sometimes they show no clinical signs. So I've never seen it before. A lot of times they recommend to have them neutered anyway. So maybe it's because we really are pushing to get them neutered, so we don't really see the issues. So a prostatitis can lead to an abscess. So if it does become abscess, then we definitely have a much more severe situation. They might need to be hospitalized and have IV antibiotics and stuff because it'll be filled with pus. Gross. Okay. We could also sometimes see a stiff gait. If chronic, they might have a history of constantly getting UTIs. And then maybe we can start looking back and thinking, this dog constantly has UTIs. That's weird. And then actually research and maybe find, right, that they have prostatitis as well. Okay. So neoplasia of the genital tract, so prostatic neoplasia is uncommon, but if they do have prostatic neoplasia, it's malignant. So they have an abnormal growth there, it's going to be cancer. And you can try to do radiation. It's just usually not very responsive. So it's literally one, that's it. That's all I have to say about it, because there's not really any options here. Chemotherapy, radiation, but again. The other thing about prosthetic neoplasia is you can see it in both neutered and intact. Unrewarding treatment. Cure is unlikely. It's actually uncommon in dogs, but it has been seen in cats. And either way, it's not good. Okay. The next disease, I've never seen this one either, and this is so weird, and I am so glad I have not seen it because it's gross. TVT, transmissible venereal tumor. This is a different disease from prosthetic neoplasia, okay? It's different. This occurs only in the canine. It's a cancer. It's transmitted by sexual contact or direct contact, like licking and sniffing, with the infected tumor. If it's passed to a female dog, then she's actually going to have the growth on her vulva. I think that's better, don't worry. So, spread during sexual contact, tumors found on the penis, prepubes, scrotum, cauliflower-like. It's not white, but they look lumpy, like cauliflower. I don't know. So treatment with chemotherapy with the vincristine, which is just a type of chemotherapy. Surgical removal of the small localized masses can be done. I've never seen this. I don't know how common it is because I've never seen it, and there's actually not a whole lot of information on it. These tumors do grow rapidly at first and then remain static for a time. Eventually, they spontaneously regress due to antibody production by the immune system. So it's really rare that they'll just kind of go away. They can. This is what they can look like. Most are ulcerative and bleed. Like movable, like they're kind of. Pretty gross. You can definitely see that would be a painful situation, right, for the animal. That's all I really have for it, is just removing them if need be. They don't go away. I've never seen it before, but you need to know what TBT is. It's pretty nasty. And I don't know, let me see if I have it in here. If there's a specific age. No, clearly it's passed through sexual contact, so it's going to be after they've bred, so at least after 6 months, but there's not a whole lot of information. I even think in the book it's like a paragraph. It's one of those. Okay. So cryptorchidism, this is actually cryptorchid, right? So one of the testicles, one or both, it could be both, they actually are retained in the abdomen. And so they do not push through the inguinal canal. These guys still produce testosterone. They show sexual desire and they can breed, although spermatogenesis is usually absent. So they usually won't get the dog pregnant. Does that make sense? But that doesn't mean that that can happen. It just means most of the time it doesn't. Does that make sense? Okay. Let's see. A testicular tumor known as Sertoli cell tumor. You guys remember the Sertoli cells? They kind of help move the sperm into the epidermis, right? Yeah, so there's actually, most of the time when they are cryptorchid, they can actually have a tumor that is involved, which is a Sertoli cell tumor. Up to 14% of Sertoli cell tumors in dogs are malignant, and they will metastasize to surrounding lymph nodes in the body and other organs. So if you do have a dog who's cryptorchid, a lot of times you want to send out the testicle that was retained to make sure that there's not, like, Sertoli cell tumor. I'm not really, that's just the type of cancer that you could see with it, like if it's retained. For whatever reason, their testicle didn't drop like it should. And so they don't always have tumors though, but if they do, it's most likely a Sertoli cell tumor. It's a developmental thing. It's definitely, it's hereditary. So you definitely do not want to breed a dog who was crypt orchid. Even though it's less likely they will, you still don't want to breed them because it could happen again, or it could happen to the next animal. So they should not be bred. So I have a funny story about that. I know you're like, what is with her funny stories? So my friend, she's one of those people, she likes to go and get like an expensive dog. And I don't really know why. She has one rescue dog that's actually kind of a nutcase though, so maybe that's why. Anyway, so she got this little Chihuahua. His name is Frodo, and she paid around $800 for him because he was just so cute, and she wanted to breed him. Anyway, this was before we were friends. So she got little Frodo, and then realized that Frodo only had one testicle. So they had to neuter Frodo, and she couldn't breed him. And she paid $800 for a dog who had one testicle. Womp womp. So I did ask her, well, did you learn your lesson? Do you think it's not a good idea? You could have went and found just a cute little Chihuahua with 2 testicles. But she probably didn't learn her lesson because sometimes she's like looking for another puppy, and I'm like, because Frodo did pass away in 2020. It was very sad. But yes, so she was one of those people where she'll go out and just buy this dog, and then she ended up getting a lemon. He also had like a severe case of Giardia. She had a fun situation at first. It was great. Okay, I wasn't part of that though. I just heard about it and then laughed. So again, these animals should not be bred because it's not, especially in that situation, if he were to have bred and then she tried to sell those puppies, people aren't going to want that, right? Just in case, because it could happen to the puppy that they adopt. So 2 normal testicles, unilateral crypt orchid, right? So treatment is castration. The testicle should be removed from the abdomen, or you can even push it down in the inguinal canal. We definitely had a cat one time. This is another story. So this cat came in. It was a feral cat. This man was always catching cats. And he brought this cat in that he was able to put into the carrier who was trying to eat us. And so the plan was to gas the cat down and to neuter him very quickly because he was just going to go back to his life outside. So we were going to give him a rabies vaccine and we were going to neuter him. Well, a neuter takes about 2 seconds. I'm just kidding. Not really, but pretty quickly, right? We don't even have to intubate cats. With dogs, we still intubate. We still do the full procedure. You're going to see a difference here when I show you the videos. But with cats, you can usually just knock them out with sedation, and then you can put oxygen on their face, and you can neuter them very quickly. They're kind of like a rabbit. Well, the problem is when we did gas this cat down, and I did give him an injection, right, to sedate him fully, he only had one testicle. So he became a full anesthesia case. We had to intubate, take him into the OR, and cats definitely have all that fat right here. She had to dig in his abdomen to find it, and she did find it. It was so teeny tiny. I was like, how did you find that? Because it wasn't even developed. Sometimes they're developed inside, sometimes they're just really small and they never developed. So that was another situation where we were like, yeah, we're just gonna go ahead and neuter this cat super quick. Yeah, never say that because it didn't happen. We had to do a full anesthesia case. And cats like to try to die under anesthesia. Like they're really awesome at that. So they're never fun to run anesthesia on. So he kept like fluctuating. Like cats either get really deep under anesthesia or they like try to wake up. If you have one that's like happy medium, it's like a blessing and you're like, I don't know what I did right in life. I don't know why today worked out, but it's amazing. They like to do that. They're very interesting. It's just because it's a cat. They make no sense in life. That's just something you'll learn as you like get in. I'm telling you, when I worked at Sugar Land and we had to run anesthesia all the time as a surgery tech, I was like, oh, a cat. Because it was like the longest 3.5 hours of my life. Thankfully, with like a neuter or a spay, it's like maybe an hour, maybe. So it's only like a stressful hour of your life. But when you're doing a specialty procedure, sometimes it's 3 to 4 hours, and you're like, why? So it's pretty. It can be pretty intense. So castration, right? Here we have. So we're gonna do. We might have time. We'll do the feline neuter today. And then we're almost done. Oh, we have to do mammary tumors. We'll start endocrine as well tomorrow. I'm going to get the first one up for you guys. So the removal of the testicles, right? Vas deferens, so the spermatic cord, are tied off. The cremaster muscle is the muscle that covers the testes, right? And spermatic cord. They can sometimes use lidocaine around the testicles to help with a local block. That's usually what they do with the kitty cats. And then removal of the dog's testicles causes the production of testosterone to come to a halt, right? So actually, when you do neuter them, it often leads to like marked decrease in behaviors driven by the hormones. So like urine marking, roaming in search of like other female dogs, being competitive. Our friend's dog, Boomer, he wasn't neutered for a long time, and he was always roaming the neighborhood and trying to knock up the neighborhood dogs. And he finally neutered him, thank God. And now it's weird. Boomer actually like stays around the house. I'm like, oh, would you look at that? But yeah, so it's definitely a important thing to consider, called an orchiectomy. So we can probably watch the kitty cat one because it's super quick. They do neuter a cat differently from a canine. So do keep that in mind, but we'll watch the canine one tomorrow. And then I will be getting endocrine up today. That's what I plan to do today, is edit the endocrine PowerPoint. I'm gonna have a great day. I get to read the endocrine chapter. Huh?
I was gonna say, teacher, I had high school, she was that she showed us the video of Jennifer's cat, Oliver, neutered.
It's pretty, I mean, I think they're kind of fun to watch. The cats are pretty fun. Rabbits are pretty cool too. They'll kick you. Sometimes you have to hold their feet. I mean, they're definitely out, like, but it's like they're, even when they're out, they're just like, don't do it. So let's see, is this the, oh no, that's the canine one. I'll get my life together soon. I'm just kidding, I won't. But I'll try. All right, here we go. It's gonna be great. About 3 minutes for one testicle. So maybe 6 for both, right?
Hi, my name's Carolyn. I'm a technician, and this is Dr. Mitchell. We're performing a neuter today. So the first thing, once the animal's sedate, we like to, instead of clipping the scrotum, we like to pluck them because it doesn't cause as much damage to the skin. So you can usually just grab underneath, and then you'll just sort of pull it against the grain or pull it
Their hair does just come out.
the way that the fur is running. So it should just come off. Sometimes they'll get a little bit of blood, but so you just want to expose as much as you can, like if you were shaving. So that side's done, so we'll work on the other side. You do want to grip underneath just to kind of pull them out so you have something to work against. Then once you're done plucking, you want to clean it with some sterile chloric solution.
So a neuter, all I use for neuter, a set of sterile gloves, a sterile blade, and a sterile hemostat. So for the neuter, you're just going to isolate one of the testes within the scrotum. And then right over the testes, make a small incision. It should just pop out. And I'm just using a closed technique, tying the cord on itself and making sure I have all the testis moving. And then the cord can be slid back down to to make a knot. Tighten up. Before releasing it back into the body, you just want to make sure there's no bleeding. And then the same on the other side. Isolate it.
Never 3 minutes ago.
Quick incision.
Remember she cut through that tunic?
Use dry gauze just to strip away some of the fat and connective tissue. Nice and tight. And just return that to the body. It's done.
All right. See? That was it. We don't close it up. We don't do anything. Just let it do its thing. So you can see why the doctor I was working with that day was slightly frustrated when we had to actually go in and remove one from the abdomen, because we actually did it on our lunch break because we thought it would take us about 10 minutes, and it didn't. It took a while.